for our monthly visit with Woodlawn Health as we welcome Brad and Kristen to the program. Good morning, folks. How are ya?
We are living the dream, sir. Living the dream.
Hey, it's nice outside now. I was just out and got the mail, and it's pretty nice. So
yeah.
Enjoy it for a few more hours.
You saying a good day for yard work or no?
If you're out there now doing it,
okay,
yes.
So get done quick.
Yeah.
I agree.
By lunchtime, you might want to be finding you some AC or water.
Absolutely. We always tell
Or
everybody,
both.
if you've got any respiratory issues or cardiac issues, really make sure you're well hydrated and stay out of the sun if you can, and really take it easy on these days, because we do see an increase in those kind of exacerbations with those kind of issues. So.
And it doesn't take much.
No, it doesn't.
With 106 heat index.
Well, you can go from perfectly fine to a heat stroke-like symptoms in just a very short time.
Yeah,
Not to mention that we know that skin cancers in general are on the rise across the nation, and so making sure that if you are out in it, that you're hydrated, but then also well protected with SPF. So
good little community tip there.
Absolutely, good for all of us, right?
Yeah,
absolutely.
So you had a board meeting. How'd that go?
We did. We had a good board meeting yesterday. Everything went well. Got a couple of updates for you. From a financial perspective, I got nothing for you today, guys. As you know from some of our online posts and such, we had a cybersecurity event that happened about 2.5 weeks ago that caused our systems to go down, and we were on paper for a short time there. But we're back up, and the EHR is running well, and all the other systems are slowly coming back online. So we just want to let you know that. So I don't have the financials, we're still working through getting all that data back online.
Hey Brad, can you explain what an EHR is or an EMR is?
Yeah, our electronic health record. So the system you need to be able to go in and see your doctor and have that visit put on the computer system through our new system Epic is all back online and running. So just want to let you know that. We were old school. We were analog. we were pen and paper for a short time, but I do want to say that the team did an amazing job of getting through that time and getting everybody taken care of. I know that it was probably a delay here or there for patients as they called in and were trying to either get visits or get refill on medicines and those kinds of things. That also seemed to have coincided with the closing of a local pharmacy, the Walgreens closing, and so that kind of made things even more challenging for some patients. But we do want to thank all the patients that were patient and kind with us through that time frame, because that was a lot of challenges. We had just switched over to our new system, which is going wonderfully, I will add.
And a side note, just to make sure everybody knows, that had nothing to do with it, right?
Absolutely zero to do with the situation. Totally separate. In fact, that system is probably one of the most secure in the country. So that was a wonderful thing. It was a very good thing that we had already went to that system prior to this. So no, nothing to do with that changeover at all. Want to thank everybody for that, and just let everybody know too, is we've gotten back up and running for the most part, and we're working through those kind of final kinks. When you do call in or when you come in, be patient with the staff. That staff has went through the ringer in the last 38 days. From a year's worth of planning and the flipping of the new switch to then 2 weeks after that, all of a sudden everything going dark. They have been an amazing group of people, the staff. They've taken care of everything very well. But be patient, be kind with them. We'll get there. Everything's going the way that we expected it to go after such an event. And I do want to put a big shout out to a couple community partners. When this happened, I reached out to some of the local areas, local businesses and stuff, for a little bit of assistance. And really what I needed a place I could send some people with some computers to get on the internet and do things like payroll and just keep up with what's going on. And I want to do a big shout out to Kathy Adamson, the auditor, and the county commissioners. They allowed us on that first week to come over to the county building and set up shop in a little area for our HR team to be able to do some work and get things taken care of. And then big shout out to the Rochester Community School Corporation. Superintendent Ms. Vance, wonderful job. She allowed us to take over a large room over there in the Learning Center. We took 22 people over there for 2 weeks. And what a gracious host and what a wonderful community partner. That really was one of the big reasons why we were able to be back up and running so quickly. because that allowed us time to get all of that information put back in the system as things started spinning back up. And so I do want to put a shout out to those individuals there as well. So we'll get you an update next month on the financials. We'll have 2 months worth, guys. Double the amount of information.
Double the fun.
Absolutely. So only big change, I guess I would say, from the board meeting from an equipment standpoint yesterday was the board did approve us moving forward with a new chemistry analyzer. Typically, if you're not replacing them every 5 to 7 years, you're behind. And so we are replacing one of those. That'll match nicely with our system. It connects directly into Epic. And so we'll be putting a new chemistry analyzer, a CBC analyzer online here shortly. So
how is everything with Epic going? Obviously you got kind of sidetracked a little bit with the other event, but how's things with Epic?
it is going well. I think, obviously the cybersecurity event didn't make things that much fun there for a while.
Yeah.
But as our chief nursing officer, and we were talking about this morning, had said to some of the practice managers, what this did was it forced a lot of our team members to do a whole lot of work in a short period of time, because they had to go in and register every single one of those patients that was on paper had to be put into the system so that we could backlog that information. And so I think they're experts now. I mean, they work 10, 12, 14-hour days, weekends included, for the last 2.5, 3 weeks to get caught up to where we're at now. And so as much as it was a horrible curse to go through that, there's a little bit of a silver lining on some of the things that we learned. We learned a lot about Epic in that time frame. So
Cool.
System's amazing. I will tell everyone, please, when you do have an appointment, you get that text message or you get that reminder, sign up for MyChart. My goodness, I got mine set up, and what a wonderful tool.
Yeah.
You can get on that app, and in seconds you can you can send a message to your provider. Eventually you will be able to register for visits.
Okay.
On there. You'll be able to see your medical record, and so a lot of times you can get the information you need without having to make a phone call.
Yeah.
And in seconds. So that's going to be a wonderful thing for everybody moving forward.
Awesome.
So,
Cool.
And it will also do prescription refills, right?
yeah, you can put in a request to your physician for a prescription refill, not have to worry about waiting on hold and that kind of thing. That gets routed directly to your primary care provider because they're in the system as your provider. And so it pops up on their screen in their little to-do box. And so just a wonderful, efficient way to get things done.
Awesome.
Yeah.
Cool. Krista, what do you got for us today?
Well, it is community events, and we have been out and about. So if you stopped and saw us, thank you so much. We've been at the Miami County Fair, the Fulton County Fair. We've also been at the Marshall County Fair. Interesting fact, the Fulton and Marshall were on the same week, so our team did an outstanding job balancing those two fairs. And then, of course, the 4th of July parade, we were in Akron, and we did water guns this year. We did not know that there was some people waiting for us with water hoses.
I left completely drenched.
Yeah. Probably felt good though.
It was a hot morning. It felt great. But yes, there were some sneaky individuals that had their water gun, their water hoses ready.
Yeah.
And so we thought we were being slick shooting a little water gun, and all of a sudden
They're shooting back a little
they're
more.
shooting back a lot more.
Their volume was a little bigger.
It was, but it was a great time.
It was a great time. It's the first time we've ever done water guns, and I think we chose the best morning to do it. So coming up in the August, we'll be at the Fulton Parade, which is hard to believe, next weekend.
Wow.
I know, right? It's hard to believe.
August already.
And then we also will be at the Hispanic Festival in Warsaw, and then the Rochester Parade is on the 23rd, and then we'll be out at the Bell Game, and we will be cheering for both sides. There's a lot of camaraderie talk in our office currently, or in our hospital, and then we'll be doing the Bell Game with the Kiwanis Fall Festival. So if you see us out, please stop and say hi. We love to greet and meet our community as well. Also, another fun fact, as you know, we are one of the few hospitals that delivers babies, and so we got some data back from our Q1 of 2025. And within the 3 counties, we are the top delivering hospital for the quarter. So we take that as a huge honor, and we're excited that for what our team's able to offer with Miami, Marshall, and Fulton counties, along with others, but that's the focus.
Yeah, we're definitely happy to be here and be that consistent OB presence in the area because, as you know, both nationally and statewide, there's a struggle. You know, Indiana unfortunately is ranking somewhere in the 46th out of 50 states for maternal mortality and fetal mortality rates, and that's just not acceptable. So we're happy to be here and happy to take care of those kids and moms.
Brad, I know there's a lot of talk with the different bills that are going on throughout. How does that affect Woodlawn?
There's a significant effect for Woodlawn, absolutely. You know, we're not quite sure exactly how it's going to roll out,
Okay.
but anytime a small rural community has a loss of insurance to the citizens in that community, it affects the hospital.
Right.
And it affects the community's overall health. People tend to not go to the doctors often, and then obviously when they do, then they're very, very ill, and typically it leads to a higher number of ER visits as compared to primary care checks. And so, yeah, it's going to be a struggle. You know, I think we're expected to lose in the state of Indiana around 800,000 people from the Medicaid state insurance program, and that'll hit Fulton County, like many of these small rural counties, very hard. There are some other bills that are out there that may help us. We're
Okay.
still waiting on how they're going to be rolled out.
Gotcha.
So there has been some money set aside for rural hospitals and rural areas for healthcare. However, it's not been really delineated on how you qualify and how the states are going to divide it up.
Gotcha.
Some of it will be determined directly by the federal government. The other half of the money is apparently going to be allowed to be doled out based on each individual state's criteria.
Okay.
That hasn't really been worked out yet.
So, kind of like the local government, a lot of questions still out there that nobody can answer.
Well, there are. I mean, there really are. I mean, a lot of these bills have a generalized framework, but then when you apply them in action, we won't really know.
Yeah.
You know, the requirement for work for Medicaid coverage. A lot of the people already receiving it are working, so the numbers may not be as bad as far as people losing insurance. We just don't know until they get it down and apply it at that state level that's determined it. But definitely something to watch. And you know, I always tell everybody, if you have the ear of one of your state or federal legislators, let them know how important rural health care is.
Yeah.
I mean, we in the rural communities across the nation account for 70% of the land mass. And so all of those individuals typically fall under some rural health program, whether it is a hospital, a rural health clinic, or such. And oftentimes in those areas, they're having to travel further than normal. You know, there are challenges that the rural community faces that other healthcare entities and healthcare areas don't face. And so it's important to make sure they know that, hey, we're here, and we need you to make sure you're considering us in every decision that you make related to healthcare for the communities.
Awesome. Appreciate it. Anything else this morning?
No, not that I can note. One, again, thank you guys for all your support, and enjoy the summer months. Stay cool,
Yeah.
and
Especially the
we'll
next
give you a
couple
better
days.
updyou next month on what's going on.
All right. Well, good luck.
All right, thank you, sir.
Woodlawn Health Report here on the morning show. That's going to do it. Have a great rest of your week.